I'd like to read you a quote from the European Heart Journal. It was written in 2019 about cardiac sarcoidosis. This disease is life-threatening and often not found until after people die. Nearly 2/3 of deaths related to cardiac sarcoidosis are caused by undiagnosed granulomas in the heart. And that was true in my case. I had this for 5 years before it was ever diagnosed. Got a clean bill of health since, I want to stress that. But I share this to you for several reasons. Someone here, or some of your friends and family, you may have cardiac sarcoidosis and you may not even know it. Okay? So please let that sink in for a little bit. Listen to the symptoms that I'll explain in a minute. I have a duty to share this story. This story must be told. It's found in autopsies. If you ever heard of someone who had cardiac arrest in their 40s and 50s, and everybody said, isn't that a shame? Chances are they died of cardiac sarcoidosis. So symptoms started for me, had 104-degree fever in February of 2014, but I was fine the next day. Mayo Clinic says you're exposed to something. They think maybe green tree pollen or whatever you're allergic to, or they don't know. That's part of the foundation. We want to find a cause. We want to find early detection. If there was a blood test and they said, okay, you got these symptoms, take this blood test, you got sarcoidosis, here's prednisone, here's your steroid, you'll be fine. It would have saved me a couple pacemaker surgeries and a heart transplant. But after the cough, the strange cough, many of you may remember, I couldn't even get through a speech. Dizzy spells, shortness of breath, heart failure symptoms. If you have any of that stuff, go to your doctor and ask about cardiac sarcoidosis. The second reason is foundation purpose. And the steroids kill sarcoids. It's a treatable disease. This is not like, this is a treatable disease if there was just a blood test. So the goal for the foundation is early detection. But the third reason to share this is the parallel theme of resiliency and restoration. I'm going to kind of shift into the panel discussion at this point. Because I'm revitalized personally with energy. So is the petroleum program, well on its way. Thanks to a lot of help of a lot of folks in this room. I want to make a quick note that 2019, 2020, I was out for a long time. Years ago, I set the company up so I could focus on CEO and industry association activities and really focus on industry leadership and helping establish or develop or contribute suggestions to environmental policy. After the years of performing environmental forensics, working hand in hand with the DEP, we were able to develop some pretty good ideas and assist. So here are my operations. Never missed a beat. Sorry for the poor pun. But while I was out in 2019, 2020, things continued smoothly through COVID, and I can't thank the team of environmental risk management enough. So thank you from the bottom of my new heart. So in 2020, my heart failed. I essentially died on July 29th. I got 7 heart offers in 3 days. Heart transplant August 3rd. They expected 40% exercise recovery. I hit 209%. 90 days after being discharged from the hospital, I climbed Sharp Top Mountain in Jasper, Georgia. It's recovery. Medical technology is amazing. Meanwhile, I'm having a transplant August 3rd, and there's this thing called the Revenue Estimating Conference going on August 7th of 2020. And they projected a $5.4 billion shortfall headed into last year's session. Followed shortly thereafter by the PRP pause. So I wake up from ICU, talk about a wake-up call. It was time for revitalization in more ways than one. In September of 2020, I look around the room here and I see a lot of friends that were involved in helping. We developed something known as the Informal Coalition of Environmental Assessors, Environmental Associations. We Zoomed every week, or every week during 2020 and every other week in 2021. And we informed legislators over the value of the petroleum program, the drinking water protection, groundwater protection, real estate transactions dependent on the cleanup program since 1986. We connected with the Florida Bankers Association. This program is so important to lenders. They rely on this program, how important it is for the economy, the jobs. Most importantly was the institutional knowledge that was lost, unfortunately, due to the pause. We need to get everybody back now that the funds are back. With the powerful help of valuable legislators like Kevin Cleary with EPOF and Ryan Matthews with Florida Groundwater Association, and the participation of stakeholders and practitioners like you, we met with DEP officials and key legislators, and our white papers hit the desk of every legislator in Tallahassee. We heard words like, these are the most impressive white papers we've seen. We tracked the Department of Revenue data, and I'm pleased to say that we are on a run since May of over $23 million a month in receipts in the Department of Revenue for the Inland Protection Trust Fund. That's a pace of $280 million a year, which is higher than it was before the pandemic. The economy of Florida is restored. Obviously, population growth has put pressure on our water quality, water quantity, our resources, and our springs. Listen carefully, please. The environmental policies that we set now will establish what we're looking at 50 years from now. So our legislative activities and our decisions on environmental policy that we make now are vital for Florida's future. And our panel here today with